So the next thing on there is post-isometric stretching. Post-isometric stretching is something that I personally love. I like having it done on me quite a bit, and I like using it. Essentially, iso means same, metric means distance. So what we're doing is we are bracing the muscle and then asking them to flex against the pressure to tire the muscle out. And then in the refractory period where the muscle is tired out and restoring itself, it's vulnerable to stretching. So we've flooded it with energy and it's fought us and it's worn itself out. Now we can go in and either passively, we can do it for the person, actively have them stretch with our assistance, or do it in a mixed fashion where we start with one and move to the other, start by guiding them through the motion and then let them take over. But I typically use passive motion in a lot of this, just because I feel like it's easier for me to let them completely exhaust themselves, and then rather than asking the body to do another job, which they may do improperly, I can guide the musculature, the kinesiology of what needs to happen. So that's the basic idea of post-isometric stretching, is just you brace whatever the structure of the body is that you want to stretch, and then have them flex the muscle that you intend on stretching. So fight against resistance. And then once the muscle's tired, you have them breathe and release, and you stretch back the other direction. So if we were going to do the quad, we would have them try to kick, which I'll show you, like when you have somebody laying down, it's easy to brace against the shin, and have them try to fight you against by kicking forward, and then you can push it backward and stretch the quad. But
that makes sense though.
But yeah, tire the muscle out and it can't fight you anymore. Basic idea. The next one on there is pin and stretch, or glide and stretch. Again, one of my favorite techniques, especially for things like neck work. I find it super, super effective on all the different muscles of the neck and upper shoulders, traps, all that stuff. But especially all of those little muscles, things like the scalenes and all of that stuff that can be difficult to get to and really work properly because you don't want to push straight down on something. So essentially what we do, and again, you can do this actively or passively, so you can guide them through the motion, or you can have them do a repetitive motion while you pin the muscle. But what we do is we shorten the muscle as much as possible, so we bring the attachment points together, pin down the belly of the muscle with a tool or a thumb or whatever, elbow, whatever you need to use, and then stretch it against that pressure. And so it creates a choke point in the muscle that basically irons out that tissue, as opposed to just stretching something where when something's kind of bunched up and then you try to stretch it, it doesn't always cooperate. And then we put extra strain on the joints or we don't stretch it properly because the body's fighting us trying to stretch it. So it's a more pointed way of getting in and individually working little sections of the muscle. We'll stretch it in different directions, and it's one of the fastest ways to increase mobility in somebody. There's a third version of this that I don't really ever use unless it's in a sports massage type of situation, but it's called spray and stretch, and it's essentially you spray it with biofreeze, and while the muscle's completely numb, you stretch it while the person can't feel it because it's just that painful and inflamed. I have almost no use for that technique. I personally, and this is just me, it's not anyone else's opinion, if you're numbing something out in our field, stop touching it. If something's cold and tight and numb by nature, then the person can't feel if you're doing damage. And if it's already that inflamed and angry, it probably doesn't want to be touched anyway.
Yeah, I don't understand the biofreeze thing because I always feel it just goes to the surface anyway. It still doesn't have to numb an actual muscle.
Different people have different levels of success with it. For some people, any relief is better than no relief, especially again if you're working a really active job. You know, I've seen a lot of people in very active athletic plays, like stage plays that have like lots of moving parts where people have to just punish their bodies to get through it. Do it to get through the next scene. Yeah. A lot of people that work, like my dad's a crane operator, and he sits like this all day in like this weird awkward position. I'm sure that if somebody handed him a tube of biofreeze, it would be gone by the end of the day, because he's sitting in an awkward position and he has to stay that way. So, you know, it's one of those things where you have to do what you can.
What about those little electronic nodule things? I've seen that actually work.
Like E-stim?
Yeah, it's just a little tiny, just shocks you, lets go, shocks you, just kind of electronic stimulation, I guess is good.
Yeah, it's great because again it's doing a couple of things. You know, it's playing with the actual neurology of the muscle. It's creating a vascular pump in the muscle by flexing and releasing. By creating that vascular pump is also starting to filter out all the acetylcholine that is built up that's telling the muscle to stay tight. It is also just tiring the muscle out. A lot of times, just tiring something out in a way that's not pushing it to the limit can have a relaxing effect. Like bodybuilders, you know, that working weight that you need to accomplish to really achieve bulking growth in the muscle is like 80% of your 1 rep max, as opposed to working with light weight and doing more reps, which will still, you know, burn fat and maintain the muscle that you have, and that, you know, anything that's relatively light, you can get a lot done, but it's not going to cause that growth in real tonus, like the bodybuilder arms kind of thing. You know, it's not going to cause that kind of bulking growth, and it's not going to cause that over stability of the muscle that ultimately ends up causing bodybuilders health issues of their own. You know, they deal with a different set of health issues because they're hypertoned and dehydrated. You know what I mean? So like we all deal with different stuff, but that's a great thing for them specifically, because without wearing themselves out doing work in the gym that they find useless for, you know, building the body that they want, they can then go and have this, you know, secondarily done for them, and it relaxes the muscle a little bit and gives them better quality of life. So, you know, there's always a trade-off. But yeah, E-stim is a fantastic tool. There are other tools that can accomplish things like that too. One of the things people, you know, cupping is huge right now. One of the things that I think cupping actually is useful for is for breaking up concentrations of acetylcholine, and by, you know, reinvigorating muscles that are deprived of oxygen and nutrients because they're too dense. Because you're literally pulling blood through the tissue. You know, we can debate other uses for it, but in terms of just providing deprived tissue with, you know, oxygen and nutrients and flushing out the toxins by vascular pump, pretty useful. Let's see, the next thing I've got on there, deep myofascial strokes. Myo, muscle, fascia, connective tissue. Deep. You know, it's just the deep work. It's the Swedish but deeper side of this stuff. It's all of the techniques that don't come from a particular tradition, that don't have a particular name. It's putting your elbow down instead of your fist, or putting your fist down instead of your thumb. It's all of the stuff that using good body mechanics will give you naturally. So how can we affect the muscle and the tissue at a level of depth that can correct it structurally? The next thing on there, thermotherapy and cryotherapy. The therapeutic application of heat and cold. One thing that we've got going right now are hot towels in the warmer. I don't have anything cold right now because I figured with the weather, almost any therapeutic application of cold, unless we have an acute issue right now, is not going to be great. And we do have like cold water bottles and stuff. So if one of you twists your ankle while we're working, we can handle it. Like we can ice it down if we need to. But we're not going to do a lot with cold treatment today. We can talk a little bit about it. But therapeutic application of heat, especially when we're working with deep tissue stuff. If somebody walks in and they've got traps that are made of stone, you know, like there's just no getting into the tissue. You start working and you can't get below that surface sheet of musculature to get underneath to all of the rotator cuff stuff, the paraspinal stuff, all of that. We can use heat to loosen the tissue. Heat and moisture loosens tissue. So we can use that. It will increase blood flow, and it will create a state of relaxation that we don't have to work against the muscle to achieve. So we will play around with that idea. A lot of times, though, if somebody comes in for a particular problem, I'll start there, see what we're dealing with, apply some form of heating pad or hot pack or hot towel, cover it up, seal it in, leave and work on everything else for half an hour and come back. Or leave and work on everything else for 20 minutes and come back. And by that point, the heat will have done a lot of the work for me so that I can really get into the root of the problem without breaking my hands to do it. And the last thing on there, rest, ice, compression, elevation. There are other acronyms, there are other treatment protocols, but I put it on there specifically, again, for contraindications. Acute injuries, don't work on them. If somebody's like, I got in a car wreck, but it's okay, don't work on them. If somebody says, you know, I fell down my stairs and my ankle's kind of bruised, but I don't like doctors, don't work on them. Know what an acute injury looks like. Know what your time frame is for when something is in the acute stage, in the inflammatory stage. You know, understand that that first 72 hours is critical in terms of you not putting your hands anywhere near it.
This is something more to send somebody away with than to actually use.
Mm-hmm. Or if you're doing event work of some kind and somebody comes over to you and they're like, well, she was running a 5K and like about half a mile from the end she tripped and we think she's okay, but can you just work on her ankle for a little while? No, but I can give you a cold pack. Okay. Why don't you come lay down? We'll prop your foot up. Let's see how many colors it turns. You know, like, know what to do in that situation. If somebody comes in and they're like, yeah, I got an fender bender in the parking lot. I think I'm okay, but I've got a headache. You know what? I'd rather I'd rather we wait. I don't need your money that badly that I'm gonna risk causing you harm. And if you've ever worked in a chiropractic clinic, you've seen how many people come in not knowing that their neck is broken, not understanding that they have a concussion. Those kinds of injuries. So understand what kinds of therapies are appropriate, and for the most part that you're not a part of those therapies. Cool.